Do you know how many types of diabetes there are? This might come as a surprise to many, but there are several types of diabetes, each with its unique causes, risk factors, and management approaches. First up is type 1 diabetes. This is an autoimmune condition where the immune system, in a case of mistaken identity, attacks and destroys insulin-producing beta cells in the pancreas. Lifelong insulin therapy is the norm for people living with type 1 diabetes, which often develops in childhood or early adulthood. Unfortunately, there's no way to prevent this type. Next on the list is type 2 diabetes. This form of diabetes is the most common and is often linked to lifestyle factors like a poor diet and a lack of physical activity. Genetic factors also play a role. In this case, the body either doesn't produce enough insulin or doesn't use it effectively. The good news: it can often be managed through lifestyle changes, medication, and sometimes insulin therapy. Then there's gestational diabetes, a type that occurs during pregnancy when the body can't produce enough insulin to meet increased needs. It typically resolves after childbirth, but it does put women at a higher risk of developing type 2 diabetes later in life. Monogenic diabetes is a rarer form, caused by a mutation in a single gene. This type usually shows up in childhood or young adulthood and can be misdiagnosed as type 1 or type 2 diabetes. Treatment may involve oral medications or insulin. Secondary diabetes is a type that occurs as a result of certain medical conditions, medications, or surgeries. For example, hormonal disorders like Cushing's syndrome can cause secondary diabetes. The key to managing this type is often managing the underlying condition. Then there's prediabetes. Not a type of diabetes itself, but a condition where blood sugar levels are higher than normal, but not yet in the diabetes range. It's a warning sign that a person is at risk for developing type 2 diabetes. Lifestyle changes such as diet and exercise can often prevent or delay the progression to type 2 diabetes. Lastly, there are other rare forms of diabetes like neonatal diabetes, mitochondrial diabetes, and Wolfram syndrome-related diabetes, among others. These are caused by specific genetic or medical conditions. Management of diabetes varies depending on the type a person has. Lifestyle modifications, medication, and insulin therapy are all potential treatments. Healthcare providers collaborate with individuals to develop a personalized treatment plan based on their specific needs and circumstances. Regular monitoring of blood sugar levels and adherence to the treatment plan are crucial in effectively managing diabetes and preventing complications. So, understanding the type of diabetes is the first step towards effective management.